I'm Dr. Srivatsa Lokeshwaran. I'm a lead consultant interventional pulmonologist and lung transplant physician at Aster Whitefield Hospital, Bangalore. So many of times patients come to me referred for a procedure called bronchoscopy, and they are curious or apprehensive what exactly happens during bronchoscopy. So by the term bronchoscopy, we mean that we are putting in a small camera into your bronchus, which is your breathing tubes, to have a look inside. It is usually done as a daycare procedure with a minimum amount of sedation to allay fears, as also to keep the patient comfortable. There is absolutely no pain involved in the procedure. It is as good as putting a camera in like an endoscopy into the stomach. Now the bronchoscopy can be done for various reasons. Usually it can be a diagnostic procedure or a therapeutic procedure, or for treatment likewise. A diagnostic procedure can be done for various diseases. For example, if a patient has pneumonia and we want to ascertain what type of organism is causing the pneumonia. Is it tuberculosis? Is it bacterial or viral? And similarly, if the patient has an early lung cancer or a cancer which we have to biopsy and prove whether the tissue or abnormal growth in the lung is because of cancer or otherwise, we need a bronchoscopy. Now this is the diagnostic aspect. Let's move on to therapeutic aspects. There are many patients who come with very narrow breathing tubes and are unable to breathe well. Now this can be because of a lot of causes which is beyond the scope of discussion here, but some of these causes can be curable and some of these causes are incurable. If it is an end-stage cancer that is causing choking of the breathing tube, we nowadays have a lot of advanced technologies by which we can open up the patient's airway and put a stent in so that the patient can breathe well. And also we should be able to remove the phlegm so that the collapsed part of the lung is again going to open up, or remove clots from the lung so that the collapsed part of the lung can again open up. We are also able to deliver certain bronchoscopic methods of treating certain airway disease like asthma. Sometimes the patient inadvertently develops communications between the eating tube as well as the breathing tube, for which they might require therapeutic procedures. There are certain glands around the breathing tube called lymph nodes, and many a times the physicians refer the patient to us for a procedure called endobronchial ultrasound, which is nothing but a bronchoscope with an ultrasound at the tip. This bronchoscope is a special bronchoscope that can see past your wall, which a normal bronchoscope doesn't do, so that we are able to sample these lymph nodes to diagnose if the patient has any infection or inflammatory disease like sarcoidosis or otherwise. So there are a lot of complex technology which are add-on along with the regular bronchoscope, which we use to deliver the best of diagnostic as well as therapeutic care. And I'm happy to say that all the A to Z of bronchoscopy as well as advanced interventional pulmonology is available to us at Aster Interventional Pulmonology Department, Bangalore. So if you have any doubts, please do get in touch with us and we are happy to sort them out. Thank you.